Welcome to this live town hall focusing on community hospitals and COVID-19 readiness. My name is Dirk, your moderator for this call. Your Douglas County Commissioners, Roger Partridge, Laura Thomas, and Abe Layden are live and looking forward to hearing your thoughts as we take on this community conversation. Also joining and looking forward to answering your questions tonight are Dr. Devin Bateman, Chief Medical Officer, Castle Rock and Parker Adventist Hospitals, Kirk McCarty, President and CEO, Skyridge Medical Center, Dr. Eric Lung, Chief Medical Officer, Skyridge Medical Center, Tom Purcell, Chief Medical Officer, UCHealth, Highlands Ranch Hospital. Now, as a reminder, if you have a question you would like to ask during this call, please press *3 on your telephone keypad at any time. Again, to ask a question, all you need to do is press *3 on your phone keypad to enter the question queue. We know everyone has lots of questions, and we'll get to those very shortly. But first, we'll hear brief remarks from your commissioners. Commissioner Partridge, we turn to you to get us started.
Thank you, Kirk. I really appreciate everybody being online, listening, and joining us this evening. This is a continued series of our telephone town halls to be able to inform and ask questions of you, the public. We are very fortunate tonight to be joined by the key professionals who are the front line of what we really see as the COVID issue. The medical professionals who are the chief medical officers for 3 of the main hospitals here in Douglas County are your individuals who are in charge of all the medical staff for each of those hospitals. So each has their own individual specialty, but they really are the ones who are the key individuals knows what is going on with the community with COVID, what is going on with the hospitals. So before we start with that, you'll hear from each of those 3 commissioners about some very timely information that is going on with the county also. But we encourage you to certainly send your questions in, because the chief medical officer will be able to give some great information. We look forward to that this evening. I'd like to just briefly talk to you on a couple of things that we're looking at with the state, speaking with the governor, speaking with the CDPHE, the Department of Health. We are asking them to look at the metrics involved with the data that they will gauge each community on. And with that metric, we're asking for severity be taken under consideration. And this is great cooperation with Dr. Douglas and Tri-County Health has really been a champion to push this, because it really does matter. No doubt we have a lot of cases, but it's the severity issue. What is going on? How severe is that illness? Are they requiring hospitalization, and what type of hospitalization? And I know we're going to hear a lot from the medical professionals tonight. So from that, Dirk, I thank you very much, and we'll hear from Commissioner Thomas.
Good evening. I'd like to welcome everybody on this evening's call about community hospital readiness. There's a lot of things going on in the news, and so I applaud each of you who called in tonight to really get a good understanding of how prepared Douglas County hospitals are. Let me just add, from my many years as a Colorado State Trooper, I often ended up talking to accident victims in emergency rooms. And I always thought that our first line responders in our hospitals, I always thought there was a special place in heaven for them, because they took care of great people, they took great care, they were just kind, and they were very well prepared. So I'm looking forward to hearing from these great hospital administrators and doctors today, so we all have a better understanding of what's going to happen as we go on into the fall here in the winter. So thank you. And again, remember, your questions this evening are about community hospital readiness. Thank you, Dirk, and on to Commissioner Layden.
Thank you so much, Commissioner Thomas and Chairman Partridge. Certainly value the hard work of my colleagues, and certainly all of the hospital professionals that have done such a wonderful job over the last 8 months managing COVID-19 on the front lines. You know, we're having an active conversation right now, to echo Commissioner Partridge. around the severity metrics. And we continue to believe that in Douglas County, we need to bifurcate between simply case numbers being positive and actual severity, meaning hospitalizations and deaths. As of today's date, we have 39 people actively hospitalized with COVID-19 with an average age of 62. And we've seen 63 deaths in Douglas County with an average age of 82. Each of those individuals is significant and important to us, but we're very thankful that our numbers continue to remain fairly low. One item that we've been looking into fairly aggressively has been around the conversation regarding convalescent plasma. And I'm sure the experts on the call will be able to share more information about that. But an emergency use authorization was provided by the Food and Drug Administration for hospitals to administer convalescent plasma, which is simply blood donated by people that have had COVID-19 and currently have antibodies. So I wanted to share with the county tonight, first of all, that there's going to be a community plasma collection event. The county has partnered with Vitalant and Castle Rock Adventist Hospital to hold a community plasma collection event on, again, December 4th, 2020. Vitalant, which you might remember used to be Bond Fees, is collecting plasma from people who have recovered from COVID-19, which can be given to patients currently fighting COVID-19. You can find more information at vitalant.org or call 303-363-2300. And you can also find out about local blood drives. So keep it up to keep COVID-19 down, Douglas County. Keep washing your hands, staying apart, and wearing masks. And I'm really looking forward to hearing more from our experts tonight about the community response and readiness from a hospital perspective. Thank you, Dirk.
Thank you, Commissioners, for sharing that valuable information with us. And now our experts from our community hospitals are looking forward to taking your questions in just a few moments. Now remember, if you want to ask a question, you just need to press *3 on your telephone keypad, or you can send your question through the website at douglas.co.us/townhall. And now let's hear from our hospitals. Our presenters will each give a brief overview of how COVID-19 is currently impacting our community. Let's begin with Dr. Bateman, Chief Medical Officer of Castle Rock and Parker Adventist Hospitals. Dr. Bateman?
Well, hello. Appreciate the opportunity to be here with everyone this evening. I'm the Chief Medical Officer for Castle Rock and Parker Adventist Hospitals, and I'd like to just start with a high-level overview about what we're experiencing in our two facilities. I would say first, as a medical community, our approach to COVID-19 has improved. I think we're seeing the outcome of that in the patients we see. Secondly, in line with Keep It Up Douglas County, we've learned some of the preventative steps that we can take as a community to reduce the impact of COVID, not only on our healthcare workers and hospitals, but also on our loved ones, our businesses, and the community in general. So with that in mind, what we're experiencing now are some increase in case numbers. We are beginning to see numbers tick up once again, and I think people realize it in our communities and in our surrounding counties. But I also think this can be turned. Having said that, our length of stay is shorter. Our ICU utilization is down a bit in comparison with March and April when we began this journey. And of those patients in the ICU, fewer are requiring intubation and more complex airway management. So I would say with our hospitals, most of our patients are certainly Douglas County residents, and this is really important and significant for us. Those who are admitted truly need to be in the hospital and are truly needing hospital services. But again, I think the key message from my perspective is there are things that we can do as a community to try to turn the tide and regain control, I think in line with some of the opening comments that were made previously. And again, I'm looking forward to tonight's discussion. Thank you.
Thank you very much, Dr. Bateman. And as a reminder to everyone listening in on this call, if you have a question you would like to ask of our experts, please press *3 on your telephone keypad to enter the question queue. Again, to ask a question, all you need to do is press *3 on your telephone keypad. Now, let's hear from Kirk McCarty, President and CEO, Sky Ridge Medical Center. Kirk?
Hello, everybody, and thanks for joining us tonight. In addition to being the CEO at Sky Ridge, I'm also a registered nurse, so I've had some experience in dealing with pandemics over my career. But I think as we approach this pandemic at Sky Ridge, our focus is really around two main principles. Number one, it was about keeping our people safe, so keeping our employees safe, making sure that they were here to take care of you if you needed us. And then the second principle that guided us as we moved through this process is really around making sure that we're keeping the community safe, because there are a lot of patients that need care outside of COVID, and many times that's gotten lost in this pandemic situation. But to give you a little update and a comparison to where we were back in March, I actually took over as CEO officially on April 1st, which was right in the middle of the first surge of the pandemic. And I think our current situation, we've just learned so much in how to take care of people with COVID. The volume has peaked again, not to the level that it was back in March and April, but it has increased. The patients aren't as sick, but they're still coming to the hospital and needing that support. I think a key message that I hope to answer today and hope to add to the conversation is really around taking care of yourself and making sure that you're doing everything you can to keep yourself safe, whether that be staying home when you have symptoms or whether it be coming to the hospital when you have other types of symptoms that the hospitals need to support you in. So I look forward to answering any questions that you have, and thank you for including us in this conversation.
Thank you, Mr. McCarty. Now, as a reminder to everyone that's joined us on this call, this is a live town hall focusing on community hospitals and COVID-19 readiness. And if you've got a question that you would like to ask our panel of experts, all you need to do is press *3 on your telephone keypad to enter the question queue. Now, let's go ahead and hear from Dr. Purcell, Chief Medical Officer of UCHealth Highlands Ranch Hospital.
Hello, everybody. Good evening. It's certainly a privilege for me to represent Highlands Ranch Hospital. I'll just echo just the previous comments and just add a couple of some more statistics about how we're handling things. Our length of stay for COVID patients during the first wave was around 8 to 9 days, and currently our length of stay for COVID patients is half of that, with much less utilization of the ICU and people needing to be on ventilators. So right now we're about 4.5 days. We have a testing site on our campus where we test, record numbers recently, but 300 plus a day that get tested system-wide in Metro Denver. We test almost 1,000 a day. One of the key changes that we've seen is the percent positivity within patients who are just coming through our testing site. Typically, like in the summer months and then August, early September, we are in the 2 to 4% positive range. And what has happened recently is we've gone as high as 12% daily positive. And so we know that the virus is more active, and so that's something, as Kirk mentioned, really trying to hone in on taking care of yourself, practicing the safer at home type of things, obviously wearing masks and different things that we've all been talking about. So I agree. I want to get started on the questions. We are ready to take care of COVID, but I will tell you, what we did see during the first wave is that people were postponing the necessary treatments that they need. And I'm an oncologist, and I see patients that was in clinic today, and we are still seeing a lot of all of our patients. Some of the time we use telemedicine, but many of my patients need treatment. And I want to begin to reassure patients that if you have a medical issue or if you need treatment, that it is safe to come in. Now, we have to take special precautions and different things, and we'll get into that. But that would be one of my main ideas and main communication points, is that we need to be continuing to take care of what you have in serious illnesses like cancer.
Thank you very much, Dr. Purcell, and everyone here on our panel who have given us opening remarks. And now it's time to get into the question and answer portion of this call. As a reminder, if you have a question you want to ask, just press *3 on your telephone keypad to enter the question queue, or you can send your question through the website at douglas.co.us/town hall. And our first caller is Michael, who joins us from Parker. Welcome to the call, Michael. I think your question will be a good one for Dr. Lung. Go ahead, sir.
Hey, thanks for having these calls. It's useful to hear all this information. A couple of the earlier speakers referenced that although the volumes of patients coming in isn't as high as it was in March and April, there was a separate consideration that was claimed that the patients weren't as sick this time around. What does that really mean? That was both. I heard two speakers reference that the patients coming in now were not as sick as they were. What is that? I just wanted more clarification on that. Thank you.
Well, Michael, thank you for the question. I think there are a couple of aspects to this. Earlier this year, there was a lot that we didn't know about this virus, and there are still quite a few unknowns. But we do know how to better take care of people now. Between the antiviral medications, between steroids, between the convalescent plasma. But what we're seeing is that although we are having patients come into the hospital and coming through our emergency department, and some of them are sick to be admitted to the hospital, sick enough to be admitted to the hospital, we haven't yet seen to their illnesses to the point that are similar to what we had earlier this year. And to be quite honest, I'm not sure that we know why they're not as sick. But I know that the therapies that we have now were not available immediately earlier this year. And so by having those therapies available to us, we are able to treat patients and get them out of the hospital quicker than what we were earlier this year.
Thank you very much, Dr. Lung. Moving on, we've got an online question. This one was submitted by Sean. And Dr. Bateman, if you'll listen closely, we'll be looking to you to start off our answers. The question is, are Douglas County ICU numbers manageable at the current trajectory?
I think that's a really good question. In fact, that's the kind of question that I think each of us on the phone tonight probably asks ourselves in our hospitals every day as we keep tabs on where things are going. I would say if we continue to see cases increase, it's going to become more and more challenging to keep up with the numbers as patients come in, even though the length of stay may be lower, even though fewer patients may require prolonged intubation and some of the longer treatments that were in effect earlier before we really learned what we could do to impact the care of these patients. But I think if we as a community continue to really take distancing and masking and hand washing seriously, if we take efforts to be cautious with small gatherings, particularly when we think about the holidays coming, college kids coming back home from out of state or at school, I think if we really take these interventions seriously and don't become fatigued, don't become tired of what we're trying to do, then I do think that this is something that we can manage. But again, I think it's going to take that ongoing effort, the very things that I think people are hearing tonight in order to do so.
Thank you, Dr. Bateman. Anyone else on the panel wish to add?
This is Kirk McCarty, and I would just like to add, one of the things that all hospitals do is we're constantly looking at this kind of data. And I think many people in the community don't realize of our partnership with the state and the federal government and the county government as it relates to COVID numbers and just our resources in general. So we are constantly looking at the COVID numbers, the hospitalizations, and comparing it to the other services that are needed within our hospitals. And it allows us to then predict and actually make decisions to do things differently moving forward. An example specific to Skyridge is every day in the afternoon, our leadership team meets and reviews every single patient with COVID, our capacity, the surge of COVID patients, as well as any elective procedures and cases that we have coming the next day or that day. And what that does is it allows us to create a safe environment for any patient to come in. And so I think the previous response is absolutely right on. What happens in the community is really going to drive whether we can manage this. But I think the hospitals, all our hospitals, are prepared to deal with any kind of surge that would come our direction.
Anyone else?
No, I would this is Tom Purcell, and I would just echo those two comments. And working with the county and with Metro Denver and the governor's office, this has been a continued daily evaluation of ICU capabilities and surge plans. So there are a lot of surge plans that have not been activated yet. In fact, we're probably not even into that point where we're where we were in the springtime. So right now things seem to be where we have it covered. But this is a daily change, and that's what the preparedness is about all the different plans.
Thank you very much, Dr. Purcell. And matter of fact, we'll hold you on here. We've got a question that was submitted by Renee that I would like you to listen to and be the first to answer. Renee wonders, are the treatments for COVID symptoms reducing hospitalization time, and is that being tracked?
So this is Tom Purcell again. Yeah, thank you, Renee. We think so. We're seeing that was mentioned previously by Dr. Bateman and Dr. Long. We are seeing a shorter length of stay. We do have protocols now where patients who come in, we have a very strict criteria and what we call a schema that begins to isolate the type of illness. If it's a moderate illness with certain types of risk factors, patients and are on oxygen get a required or get a planned dosing of dexamethasone for steroids, and then have the opportunity through emergency use authorization to receive antiviral treatment. And we're tracking this very closely. And previously, during the first pandemic, a lot of this was under a clinical trial. Now with the emergency use authorization, we're able to give these more freely. But I will say it is being tracked, and tracked not only locally but nationally and internationally. And so we're learning a lot about the virus. We don't know near what we are going to know about this virus and how to manage it, and so it's a day-to-day thing.
Thank you, Doctor. Anyone else?
Yeah, hi, this is Eric Long from Skyridge. I do echo that statement, and as I mentioned previously, when the virus came through earlier this year, these therapies, were not readily available. These were developed really as a result, right, of the first surge. And although the virus never completely went away in our communities, it did obviously die back a little bit. But with the changes in behaviors and the opening of schools, we've seen an increase in cases. But yes, for certain, we've had shorter lengths of stay because of the therapies that we can start on patients now, particularly the antiviral, provided a patient isn't on a ventilator and if they have to be admitted to the hospital. We're seeing 5 to 7 day admissions versus the longer lengths of stay that we had earlier this year.
Anyone else care to add? All right. Hearing nothing further, we're going to hold you here, Dr. Lung, for this next question. We've got Kim joining us on the phone from Highlands Ranch. Kim, welcome to the call. Go ahead with your question.
Hi, thanks for having me. My question is, of the patients that are admitted and hospitalized, are you seeing any kind of trends with coming in with existing comorbidities, whether it be obesity, diabetes, lung disease, heart disease? Is it typically those people that are being hospitalized, or are you also seeing a good percentage of people without pre-existing conditions?
Thanks, Kim. I can tell you that certainly patients that do have pre-existing conditions and comorbidities may not fare as well if they do have COVID. And you can imagine that since we're talking about primarily a pulmonary disease, that somebody that may have COPD or asthma, for example, may not do as well as somebody who doesn't have those comorbidities. But there are people who are healthy that don't take any medications that are coming through our emergency department, and some of them do have to get admitted to the hospital, which is really a testament to how bad of a disease this really can be. You know, initially, earlier in the year, it was felt to be a disease that maybe people in their 60s and older would get, or as you stated, somebody who has obesity or has some chronic medical problems. But we have seen, obviously, that there are people who are younger or healthier that do get afflicted with this disease and that do require admission to the hospital.
Thank you, Dr. Lung. Anyone else?
This is Devin Bateman. I'd like to respond as well. And I think it's a really interesting question. I think there's a lot of data that we're learning, and there's a lot of data yet to be learned about what could also predispose or even protect patients from COVID. So you've heard Dr. Purcell mention some of the underlying comorbidities or those illnesses that patients have at baseline with or without COVID. And there's been data and literature about blood type, about racial disparities. So I think there's some really interesting factors that each of our health systems are going to need to consider as we go forward.
Thank you, Dr. Bateman. Moving on. Matter of fact, we'll hold you on the call here to answer our next caller's question. We've got Serena joining us from Aurora. Welcome to the call, Serena. You're live, and your question's going to Dr. Bateman. Go ahead.
Yes, thank you for taking my call. And my question is regarding the current status of PPE within the hospitals. And also, I just want to find out what the availability is, if there's still a chronic shortage. And then also, just curious if any of the hospitals have or plan to expand their negative pressure rooms.
Well, thank you, Serena. Again, that's a fantastic question. I think I'm happy to say that the status of personal protective equipment today is a better situation than when COVID-19 first struck both Colorado as well as the United States. At that time, as I'm sure people are aware, there was a lot of concern about PPE and the pipeline and supply chain to continue it. Thankfully, as part of a large health system, we were able to maintain our supply of PPE to protect our people. Our people are the most important asset that we have. And if we don't protect our own people, our physicians, our nurses, all of our providers, then we won't have teams to care for patients in the community. So at this point, we are in very good shape in terms of PPE, and there's still, systems are still working hard to maintain that supply, not knowing what's to come definitively. But the status of PPE locally, I think, is very, very strong. So that's actually not one of my concerns. I'm not concerned about PPE nor pharmacy products as we were going back 6 to 7 months ago. And then in terms of the status of negative pressure rooms, when each of our hospitals were created, I don't think anybody predicted an event quite like this. So within Centura, we are looking at what we can do going forward with either new construction or retrofitting older construction to increase the number of negative pressure rooms, anticipating whatever the future might hold for us.
Thank you, Doctor. Anyone else?
This is Kirk McCarty, and I would just like to add, I think many of the medical leadership on this call have the same benefit, but we're a part of HCA, and HCA has about 190 hospitals across the country, and being a part of a big system has allowed us to really never be in a position that we didn't have appropriate PPE. We have implemented actually within the hospital something that may be interesting to you is we have what's called a PPE czar that manages our PPE to ensure that none of it disappears, that we know exactly what we have, so that based on all the projections that we discussed earlier, we know what we have and we know what we need to take care of the people that we have to take care of. And so I think that, that's definitely something that we've been worried about just making sure that we had what we need. As for the negative pressure rooms, I think where we spend more of our time is making sure that we have all of our processes set up to keep everyone safe in the process. And let me give you a scenario just to explain what I'm trying to say. When a person is having surgery and they have to get a breathing tube in for surgery, that creates a lot of things in the air. It could create a lot of things in the air. And so, we put in place certain processes and protocols within the OR to keep everyone safe so that the airflow that are already built into the hospital is pulling that out of the hospital and making sure that everybody in the room is safe. And so I don't anticipate us really building more negative pressure rooms. It's just making sure we have the right processes in place so that we don't put undue risk on patients or our staff.
Thank you very much, Kirk. As a reminder, if you have a question that you would like to ask, now's the time to press star 3 on your telephone keypad to enter the question queue, or you can send your question through the website at douglas.co.us/town hall. And so we've got a question here from Glenn, and it looks like Dr. Lung, we're going to rely on you to kick off our answer. And Glenn's question is, do the Tri-County hospitals have supplies of remdesivir or other treatments available if they're needed?
Yes, this is Eric Lung, and we do have supplies of the antiviral that we are using even today. We're using it every day on our COVID patients. We are using it on our ICU patients in addition to some other therapies. And patients that come through the emergency department that do need to be admitted to the hospital are being started on this medication. And as we talked about earlier, and some of the other panelists have mentioned, that it has shortened the stay for patients. Now, patients that come through the emergency department who may be diagnosed with COVID-19, but who are not so sick that they need to stay in the hospital, do not get started on this antiviral medication. It's an IV medication that is given to patients that need to be admitted to the hospital. So it really depends upon the symptoms that the patients are having and the severity of those symptoms. But we do not have a shortage at this point of that medication.
Thank you, Doctor. Anyone else? All right. Well, I've got another online question I'd like to do, and I'm going to keep you on the hot seat here, Dr. Lung. And the question comes from Candace, who is a retired 67-year-old RN, and she's looking for you to discuss current treatments in use and how readily available they are, and where is the best facility to receive them.
Well, so this is Eric Lung. So the therapies that we have currently for patients that are being admitted to the hospital, again, it depends on the severity of these symptoms on where exactly they're going to go. So a patient with pretty severe symptoms, with hypoxia, will be admitted to the ICU. They may require therapy with a ventilator. And these patients are going to be on a steroid, they're going to be on antivirals, and then they're going to get convalescent plasma. Patients that still are sick enough to be admitted to the hospital, or I should say not well enough to go home, will be started on antivirals in the hospital. Patients that are discharged from the emergency department generally go home with just supportive care. Sometimes that can mean just oxygen as long as it's not too much, but won't go home on the antivirals as it's an intravenous medication only. And from a supply standpoint, we have not had any shortages that have been concerning at all.
Thank you, Dr. Lung. Anyone else?
Yeah, this is Tom Purcell. I just would echo Dr. Lung, and also, fortunately, the protocols that we have, with the information sharing and such, I would tell you that whether it be remdesivir or dexamethasone or convalescent plasma, we've been able to standardize a lot of that in the hospitals and when to give steroids and such. We also are doing a lot of research on things that aren't quite as ready for prime time, and so in our kind of programs, we do have extra clinical trials for different particular antivirals and such, where it is truly a clinical trial, and patients who are in the hospital that may have developed an allergy or some issue or have had progression and not gotten better from one treatment or another, there are other clinical trials that are available. So those are things that are important. And then some of the most severely ill patients, there is a technique called ECMO, or extracorporeal membrane oxygenation, which literally, puts a person whose lungs are not working well enough to oxygenate the blood, utilizes something similar to kind of what is used in bypass surgery to oxygenate the blood. And this is obviously for very sick, ill patients. And so there's that type of very sophisticated treatment available right here in the metro area, and so we hope that would never happen, but when it does, in those rarer circumstances that patients have those types of terrible situations, we can try to respond that way.
Thank you very much, Dr. Purcell. Moving back to another caller, this one is Marvin from Highlands Ranch, and I'm going to keep you on the line with us here, Dr. Purcell, to start us off with an answer for Marvin. So Marvin, welcome to our call. Go ahead with your question, please. Hello, Marvin. Looks like we might have lost Marvin. We'll try and find a way to get him back into the queue. We've got Melanie on the line with us now. Melanie, can you hear me?
Hi there. Thank you, and thank you for the opportunity to ask my question. I've read a lot about what to do to hopefully prevent COVID, getting COVID, to strengthen your immune system, things such as D3 and zinc. I'd be curious to get the panel's opinion on what is best to take and how much in an effort to protect ourselves and keep ourselves safe and maybe mitigate the severity of the actual illness. Thank you.
So yeah, this is Tom Purcell again. I'm not aware of any randomized data that would say that anything taking that would help. Now, I certainly would ask the other panel members if they know of any specific type data that would help. There was the popular hydroxychloroquine discussion that has gone on that has shown that also does not necessarily, at least in studies, does not show that it helps in preventing acquisition of the virus. So I am going to have to say that I'm not aware of anything other than the more typical things of trying not to do things that are going to make you very tired. Obviously, anything that's stress and things that affect the immune system, making sure that you're getting exercise and things of that nature, everything that you can do to kind of make sure that your body is well enough to fight this if it were to get it. But I'd love to hear if anybody else has a magic bullet on this. I'd love to know.
Yeah, hi, this is Eric Long from Skyridge. I don't think there's a magic bullet per se, and I agree with the previous answer that the data as far as the zinc or the vitamins is not, I don't think it's, as you say, a magic bullet. I think what we do know, and what was echoed even at the beginning of this session, is the hand washing, the wearing of the mask, and the social distancing. And this is really something that I think has proven to be very, very helpful. And that's really what I would focus on for certain. But I can't answer about the zinc question, but certainly the masking and the hand washing and the social distancing. And these are three things that we are doing at all of our hospitals. The staff is doing this because this is what is going to prevent the spread of this disease.
And this is Devin Bateman, and I would echo that. I also would just reinforce that if there are symptomatic individuals around you, if family members are symptomatic, again, I would take those items seriously and do the interventions to really try to prevent it. I agree. I have not seen any data around interventions that are helpful. Some of the early interventions that were felt to either be helpful or even harmful, some of that has been a little less clear and questionable. So it doesn't seem that some of the early interventions, like anti-inflammatory medications that were considered to be harmful and detrimental initially, some of that data does not seem to be holding up either.
Thank you very much, doctors. Moving on, we've got Leslie joining us from Highlands Ranch. And Dr. Bateman, please listen closely to this question. Go ahead, Leslie. You're live on the call.
Hi, and thank you so much for this informative session. I think my question is really somewhat more of a comment, and that is, we hear that the cases have, and even cases is debatable to say, but the positivity rate has increased, and I find that to be of such limited usefulness, because my question then would be, well, who is the focus? Who's getting this, and how sick are they getting? And as a nurse specializing in rare disease, I find this such a dangerous thing, because so many of my patients are not getting treatment that they so desperately need, and even patients of getting acute care are putting things off. And I find the messaging so much more dangerous than the actual COVID rate. So I guess it's kind of a bit of a comment, but also a question, and I would like to get your thoughts on that.
That's a great comment. I think that there are a few things to consider. I think testing rates, I agree with you completely. Testing rates are an interesting number, meaning testing has certainly expanded over the course of time, and we use testing for so many different things. For patients who are being seen or treated with elective procedures, whether in the operating room or the cardiac cath lab or whatever the case might be, we're proactively having those patients isolate themselves to the best of their ability, knowing that people need to work and people have lives to live. And we're also doing testing on those patients before they come in, so we can help predict what outcomes they may have, or what the safety of a procedure would be for them. And if appropriate, if it's in the patient's best interest, we would then delay those procedures until those patients are asymptomatic, or with a test-based strategy may test negatively. So there's certainly proactive ways to test patients to try to identify whether or not COVID may be present even in asymptomatic patients. There are also other indications for testing, whether it's through a primary care clinic or an emergency department or for admitted patients. So some of the data that we're seeing is certainly not apples to apples with what we originally saw back in March or April. And I think the second point that you made is the danger of COVID, and I completely agree. It's more dangerous for patients in many cases, in almost every case, to avoid being seen and treated. And when you think about rare diseases like you take care of, for patients who need to be seen and treated, the hospitals have so many processes in place to keep staff safe, to keep patients safe. There are thorough screening procedures. There are visiting restrictions, which can be challenging for patients who want to come in and visit their loved ones. But again, those are things that are limited and put in place just to ensure the safety of those patients, of those visitors, of our staff, of our physicians. But by promoting an environment and having processes that are safe in our hospitals so patients can be treated and not delay care, I think that's of utmost importance. And I think what we really have seen is an increase in acuity for other non-COVID related illnesses. So for example, patients who may want to come in and be evaluated for abdominal pain, with an unintended consequence of trying to avoid a hospital with safe processes, those patients may go from a relatively easily treated disorder like an appendicitis that's uncomplicated and allows somebody to go home that same day. Instead, they may come in with a perforation of that appendix, requiring a longer inpatient stay, intravenous antibiotics, and a change in therapy. We're seeing that kind of thing not only with abdominally related complaints, but also with chest pain, with lung complaints, with other non-COVID illnesses. So I think coming back to your question and your statement and your point, I think it's really important that patients in our communities realize there are so many mechanisms in place to keep patients safe that it's really important to not delay treatment when it's needed.
Thank you very much, Dr. Bateman. Anyone else?
This is Kirk McCarty. I'd just like to add, one of the mantras we've had all along really around testing is you can't test your way to safety, you can only protect your way to safety. And what that means is we can test people all the time, and just based on when their viral load is at a certain level or not, you can get positive or negative tests. But if people wear masks and if they wash their hands, and if we wear masks and we wash our hands, then we can create that safe environment. I'd just like to add one other statement. Everyone is very afraid of COVID, and rightfully so. Bad things have happened because of COVID. But bad things happen with breast cancer, bad things happen with stroke patients, bad things happen with heart attacks, and those are equally scary things that people need to come into the hospital for. And I think, early on there was an avoidance of doing things to take care of yourself. And now's the time to get back into the groove of doing the things, doing your mammograms, doing colonoscopies, doing all the screening things that will keep you safe in the long run. Because if you avoid healthcare because you're afraid of COVID, something else may cause a problem for you over the long term.
Thank you very much, Mr. McCarty, Dr. Bateman, Dr. Lung, Dr. Purcell, and the Board of County Commissioners, and everyone who joined us tonight. We do have time for a few more questions. And Mr. McCarty, this one's for you. It came from Gail. There's been talk of the possible lack of staffing for a surge. Do you believe this to be the case?
That's a great question. I will tell you, it's something that we constantly evaluate. I think the fear of a surge right now is that we also have other issues that occur during the fall, like the flu. One of the things that we talk to our staff about is stay home if you have any kind of symptoms. And I think that As the weather starts to change, all of us develop some symptoms that potentially could be COVID or could be the flu. And I think that's something that we worry about a lot. One of the things, and all three of the hospital systems represented here are large systems, and we have access to resources maybe beyond just some single hospitals. And so we have the ability to move staff around as we need them based off of the surge. And I think we obviously rely very heavily on that. The other thing that we continuously look at is the projections, which I shared earlier on. And we're constantly evaluating to try to add additional staff where we need additional staff. So the short answer of the question is yes, I'm concerned about staffing during a surge, but I'm confident that we have the right processes in place to make sure we get the staff where we need them.
Thank you for that answer. Anyone else?
This is Devin Bateman, and I would certainly echo that, and I would add that very question is one of the reasons why it's so critically important that we ensure that our staff have all of the safety equipment they need, that all the right processes are stringently in place, and we're certainly doing those things to make sure we do have the staff we need.
Thank you, Doctor. Moving back to the phones, we've got Sandy joining us on the line right now, and this looks like a good question for Dr. Purcell. So, Dr. Purcell, please listen to Sandy's question. Sandy, welcome to the call.
Yes, hi.
Go ahead.
Thank you so much for taking my call. I really appreciate it. When this all started, we were told there was only one type of test, and the turnaround time to get results was taking a week to 2 weeks. My understanding is that there are now a few different types of tests, and I'm wondering, are you finding any are more accurate than others? And could you give me an idea of what the typical turnaround time is to get a result?
Yeah, thanks, Sandy. I'm going to try not to use too much jargon here, but testing has come a long way. We are using, and I'm sure everybody's using, PCR tests, which really test for RNA extraction or amplification of the virus. And so you may hear terms like Roche or Cepheid or Thermo Fisher. Those are makers of testing reagents and machines that have helped us in getting on top of this. The turnaround time, I've seen it as quick as 4 hours to 24 hours. That's improved tremendously. Sometimes it can be, if they batch the samples, if they're collecting the samples in one location and doing the testing in another, you can see how that would change. I do know that the least reliable tests are the ones that don't do that RNA extraction or amplification, and that's almost like a coin flip, to be honest with you. So PCR testing is kind of the standard. It does test both alive and dead virus, so it can not necessarily indicate the activity of the virus, but that's kind of how we're doing it. And so we've come a long way, and we're able to manage the daily load of 1,000 to 2,000 a day now, and so that's improved greatly to where we were in February and March.
Thank you very much, Doctor. And thank you to everyone for all of your thoughtful questions this evening. Now we'd like to turn to our presenters and have them give us their quick final thoughts. Dr. Bateman, you first, sir.
Thank you. I think it's important for the audience to know that as a healthcare system, we certainly have a large system, and having the strength of a large system is why we've been successful. But I think what's also important is for people to realize there's been tremendous collaboration among the different healthcare systems within Colorado and among the 3 systems on this phone call today. So this really is a coordinated, collaborative effort, and one that's not done in isolation. My second point would be, as long as we continue to do the things we've spoken about with masking and distancing, hand washing, I think we can really do a lot for this. And then finally, my last plea would be, this is hard. Going through this pandemic has been hard and it's been tiring. And I would just implore our audience and our community to make sure that we are taking care of one another, our families, our friends, our coworkers, our loved ones. And at a time when we need to socially distance, we also need to make sure that we are emotionally present and close to one another. And I think that's a really important piece to this.
Mr. McCarty, quick final thoughts from you, sir.
Thank you for the opportunity. I think other than, obviously I want to reiterate the mask, make sure we're masking and washing our hands. But I think one of the most important things, and I have to remind myself of this as well in my personal life, is don't develop COVID fatigue. Don't develop the scenario where you think COVID isn't going to affect you so that you do take risks that you shouldn't take. The second and final point that I'll make, and I don't really get this opportunity to do this, so I want to do it here, is to truly thank the community and to thank our commissioners and just everyone around who has supported all the staff in the hospital during this pandemic. We all joked that within the hospital we gained the COVID-19 because everybody in the community was buying food for my staff almost every day. And it really is special and means a lot, and it helps with our staff's resiliency during times like this when they know that the messages that people write on our sidewalks outside our hospital or the posters that people put up, or that they continue to think about them by making sure that they have food while they're working. And so I just want to say thank you for that, and thank you for caring about the hospitals and supporting us during this as well.
Dr. Lung, final thoughts from you, please.
Yeah, I echo what Mr. McCarty said. I do think that from a community standpoint, two things actually: the masking, the hand washing, the social distancing. Everybody is getting tired of COVID-19. It's been a heck of a year for 2020, but the virus hasn't gone away, and we can't give up just yet. And so I think that's really important. And the other message that I would say that was mentioned earlier is that the hospital is here to treat people. And one of the things that we had seen earlier this year was that people were staying at home when they had very good reason to come to the hospital. And I completely understand that because there was just a lot of unknown. And despite this small increase, or the increase in the COVID cases now, everybody should really understand that it is a safe place, and the hospital wants you to come in so we can treat you. If you're having chest pain, if you're having abdominal pain, please come in to get a look at it. It is a safe place.
Dr. Purcell, looks like you're batting cleanup. What are your parting thoughts, sir?
Well, those are great comments. I echo them all. Hospital is safe. We're doing everything we can to keep our employees safe with PPE and all the different activities that we're doing. And I would just say avoid groups. This is spread via respiratory droplets and being in close contact inside for a period of time greater than 15 minutes. And that's how people get this. And so please, as we're all tired of this, but we got to keep going, and we're going to get through it, and avoid groups and be smart as we go forward, and appreciate everyone's support.
Gentlemen, thank you very much for your time this evening. And while we were only able to answer questions about our community hospitals tonight, we do invite you to submit any questions you may have about other topics. You can send them to douglas.co.us/citizen connect at any time. But before we conclude our live town hall, we'd like to give your Douglas County Commissioners a few moments for their final comments. Commissioner Layden, let's hear from you first.
Hey, you know what? I have to tell you, I always have the opportunity each year to dress up as Superman and give out full-size candy bars to kids that can't trick or treat because they're hospitalized. But the true heroes are really Doctors Bateman, Lung, and Purcell, as well as Kirk, McCarty, and all of the healthcare professionals at our area hospitals. You are the true heroes that are carrying us through this pandemic. And you know, every day is a different type of risk, and you see all sorts of risks. Well, not only COVID-19, but anytime we get in a car or eat shellfish, or when people choose to smoke or drink, there are a lot of health consequences associated with those risks, and you take those on, and you have really given all of us confidence that we can count on you. So thank you for joining us tonight and for all you do.
Thank you, Commissioner Layden. We're going to move on to Commissioner Thomas now.
So thank you. I appreciate hearing from all of the medical professionals tonight. And I wrote down a couple of things. One thing I wrote that really made sense to me is you can't test your way to safety, but you can protect your way to safety. And that's one of our messages tonight is, you know, keep washing your hands, keep doing what you feel you need to do to keep yourself safe. And that's an important key here. The other important lesson we heard from our professionals is that if you have some kind of a medical thing that has come up, don't hesitate to go to the hospital. It's better to go now and get it treated now than to put it off and then have a worse problem to deal with. Our hospitals are safe. These professionals are ready to take care of all of your health needs. And so I encourage each and every one of you to continue to take good care of yourselves and your families. Good night, and God bless to all of you. Thank you.
Thank you, Commissioner Thomas. And circling back around to Commissioner Partridge, your final thoughts, please.
Dirk, thank you so much. You did a great job moderating. Thank you for the audience for listening and our questions. And a special thanks to Dr. Bateman, Dr. Lung, Dr. Purcell, and Mr. McCarty. You know, it's wonderful. We got all this medical advice, didn't have to pay a copay. So thank you very much. But I really believe the answers that we heard tonight were appropriate. They were pragmatic. And I really believe they provided the confidence that they answered with certainly is going to give our community a lot more ease with what we know is this pandemic. We certainly know there's many other things that are occurring besides this pandemic, which you mentioned quite often. So we ask everybody to be healthy, be safe, continue to follow all the precautions, and know that we are continuing to work to protect you to help keep your life as normal as possible. So thank you very much. God bless everyone.
On behalf of Douglas County, thank you everyone for sharing your time with us. We hope you'll join us again for future town halls. Be well, be blessed, and we hope you have a great night.